Checking in with CEO of Sunset ID Care and co-chair of the El Paso COVID-19 Task Force, Dr. Ogechika Alozie. Good morning. Thank you for joining us. And so,
Thanks for having
Doctor,
me.
what is the latest on COVID-19 and its mutations or variants? And does this frighten you all in Texas, considering that there are over 2 million cases and over 40,000 deaths?
Yeah, so I think we have to sort of focus on the good news. The good news is that we're coming down, but it has to be sort of pointed with reality by the fact that that down is still at least 50% where we were in the summer. And so those are all concerns. In as much as there are those variants, whether it's the 1351 in South Africa, the 11.7 that's out of the United Kingdom, or the P1 that's in Brazil, what's more important and what's most important is that we need to ensure that our messaging on vaccination is on point. I think that throughout the pandemic, we've probably had a failure of messaging. We've had a failure of sort of honest, open understanding that we don't know everything, but we do know that vaccines are a miracle of modern science, and it's the vaccines that will get us and our communities out of this trouble that we're in right now.
Would you say that there are some changes that are being done now that, in a sense, are righting our wrongs for not putting out information when it comes to this virus and the vaccinations? Just kind of those, for the people who are iffy about the vaccinations.
Yeah, absolutely. So I think one of the things that's important is people like Dr. Fauci have been consistent in their message around vaccines. I think in our communities of color, we need to continue to enhance and find speakers that can break this down in really basic language. The vaccines are good. There are minimal side effects. The reality is that even if you're worried about having the anaphylactic shock, it's about 2.5 million in the Pfizer, and it's similar in Moderna. Super excited with Johnson & Johnson potentially getting approved at the end of the month. This will allow a one-shot dose, and more importantly, it will allow locations in the country that don't have the ultra-cold freezer storage systems to put in a refrigerator. And so people really need to realize that it shouldn't be about vaccine hesitancy anymore. I want us to transition to that conversation about vaccine hope. We need to give people the message that the vaccines are going to allow us to be with our loved ones. They're going to allow us hang out with our friends that are also vaccinated. And I don't think it's a bad message to tell people the truth that we expect the data to show reduction in transmission. It's already there, and we're waiting for clarity. The doom and gloom is not going to cut it anymore. We see where that has gotten us throughout the course of 2020 and even in 2021, and we need to do a better job of messaging.
I like that. Hope. And as we continue this COVID talk, what are your thoughts on the Super Bowl? Of course, recently passed, large crowds, we've seen video, we've seen it all, especially after, interactions in the midst of this deadly virus.
Yeah, I mean, again, different organizations are going to make their choices. I personally don't think it was a wise choice to put 25,000 people in a stadium, understanding that about 7,500 of those were vaccinated healthcare workers. I understand what the NFL thought they were trying to do, and we'll just have to see where that goes. At the same time, the conversation that's been had about don't gather, don't get together, I think we're far enough along in this pandemic that the black and white abstinence message, we've essentially turned this into a HIV abstinence message of the 80s and 90s, where it's the demonization of being human. That's a failure. That's not going to work anymore. We have to give people nuance. And so if you're with somebody and you can socially distance, wear a mask. I think a mask, and I have masks all over my house, I think that's one of the key pieces, whether it's to travel, whether it's to gather in small groups. And once you're vaccinated, the reality is this: the risk of 2 or more vaccinated people 14 days after second shot transmitting COVID is essentially zero. And we know that from some of the data that's beginning to come out. And so again, I think we really need to be careful around our messaging. I hope that we can continue to partner to get these messages into our African American and Hispanic communities, because those communities, if they do not get vaccinated, it will continue this sort of lag that's been put upon those communities, especially with their kids not going to school. And those are all things that we need to be really clear about.
And we know that the Black community is one of the communities that are actually suffering from lack of, whether it's lack of vaccination, lack of testing. How can we better prepare moving forward to make sure that we reach those areas that aren't as easy to reach?
Think it has to be targeted, right? I mean, the 1A tranche of vaccinations that was focused on healthcare workers and long term care facilities, I think is great. Those are the communities and the populations that have borne the preponderance of this disease. But as we sort of continue to get those done, and hospitals, truthfully, are struggling to get vaccine outside of their locality, right? I think it has to go to the pharmacies. And amazing news, the Walgreens and CVS and a host of other chains are going to start to do this. The next push has to be to get it into primary care doctors' offices. They have the patients, they have those over 65s, they have the patients that have the comorbidities. And then the messaging and the communication in every community has to be consistent, that this is not the time to be fear mongering. Understanding that Tuskegee is a reality, also understanding that one of the scientists that was on the team for NIH and Moderna, Dr. Ian Moore, went to Tuskegee. Right. And so we have a position. We have people in our communities that have been in this process. They always say, you can't talk about me without me. Right. And so I
Mm-hmm.
think in the scientific world, we have that representation, and our partners are making it possible for this to be a safe vaccine. It's now incumbent upon the message makers to be really clear. And let's lead with a message of vaccine hope and not vaccine hesitancy.
And doctor, can you just take us through a quick, very briefly, experience of COVID, what it's been like for you working on the front line?
Wow. I mean, I think 2020 was a whirlwind. And so, and part of what I've done as infectious disease physician, some of the roles I've held, it's a lot of the policy and the partnering, the messaging in our local El Paso community, seeing patients that were sick and dying. I mean, I've told a story probably 100 times about a 50-year-old gentleman in an ICU where I work, and he wanted a cup of Sprite, and that was literally his last cup of Sprite. He
Wow.
died shortly thereafter. And, having children and a family, I mean, I was terrified of COVID, continuing to mask, continuing to social distance. And unfortunately, a week before Christmas, I actually tested positive. I was
Wow.
blessed that I had a very mild case. I got the monoclonal antibody because, unfortunately, because of COVID, I had gained some pounds and I met the BMI criteria. And so I'm waiting to get the vaccine. I mean, I actually am looking forward to getting the Johnson & Johnson vaccine because I need to travel to Nigeria and see my mom. And so I
Mm.
believe those variants may be in Africa more than they are in the United States. In saying all of that and understanding that we're coming down, we're getting better, right? We have to understand that the variants, especially the B.1.1.7 of the United Kingdom, may be the predominant variant in the United States by April. And so the
Well,
more
doctor,
vaccines we
I'm
can
sorry
get,
to cut you short here. We're a
uh,
little heavy on
yeah,
time, but I greatly appreciate your presence here at BNC, and I wish you the best of luck in your travels and with the vaccine.
thank you. God
Thank you
bless you.
so much.